A new type of mammogram called Contrast-Enhanced Mammography, or CEM, is now being offered here in Northeast Florida. It can help women detect breast cancer faster. Dr. Gaelyn Scuderi is a diagnostic radiologist and the director of imaging at Ackerman Cancer Center, joining us via Zoom this morning. Good morning, doctor. Thanks for being with us.
Good morning. Thank you for having me.
So the Ackerman Cancer Center is the only center in our area that actually offers this mammogram. How is it different from the traditional or maybe even the 3D mammograms that are currently offered in the area?
We are so excited to be offering this to the women of Northeast Florida because this type of mammogram, this contrast-enhanced mammogram, it offers women a higher degree of sensitivity in the diagnostic mammographic setting. So it allows us to detect early breast cancer with a higher degree of certainty, a higher degree of clarity, and really we're doing this in a very rapid fashion. It's a 10-minute or less exam.
Wow, so we have a photo showing the traditional 3D mammogram. We'll pull it up for you. It's on the left and the CEM on the right. What does this tell us by looking at this?
Yeah, so on the left, so the CEM exam feels very similar to women to a regular mammogram. The only difference is that they're going to receive an IV ahead of time and get an injection of iodinated contrast. It's the same type of contrast that we typically have with, or we typically get with CT scans. And on the left image, you would see that there is a regular traditional mammogram. This is the mammogram that gives us all the beautiful anatomic detail that we're used to. It's the gold standard of breast cancer early detection. On the right, the image is obtained exactly at the same time as the image on the left is a subtracted image that subtracts away all that white glandular dense tissue and only shows us what's enhanced in the breast. So it gives us an idea of which breast tissues are acting abnormally. So it's this beautiful marriage of form and function all at one time, all in the same exam.
So can anyone get this, or do there have to be certain qualifications, and is it covered by insurance?
Well, so these are great questions. The contrast-enhanced mammogram is used in the diagnostic setting, and I think that that's an important distinction to be made. It is not a screening exam, so it really is mostly used for women who have diagnostic indications. For instance, women who have a personal history of breast cancer, women who have elevated risk. I think this is the subset of women that are really going to benefit from this exam. These are women who have maybe family history of breast cancer in one or multiple relatives, women who have had an abnormal biopsy in the past. These women with elevated risk really would benefit from having a deeper level look at their breast tissues, especially if they happen to also be dense. So dense breasts are kind of a double-edged sword that they are an independent risk factor for breast cancer, but they also limit our ability to detect early breast cancer on a traditional 2D or even a 3D mammogram. This contrast-enhanced mammogram helps us to look deeper than the traditional 2D or 3D mammogram and allows us to get through all that density.
And we encourage our viewers to reach out to Ackerman Cancer to find more information about this if you're interested. Doctor, thank you for your time this morning. We really appreciate it.
Thank you so much.